This video shows you how to do mirror therapy to improve shoulder external rotation. This patient had a motorcycle accident about a year ago with upper brachial plexus avulsion injury. Here you see him try to externally rotate the arm, but since he wasn't able to do it for a year now, he has forgotten how to. So our goal during the initial treatment sessions was to give him an idea again what it is like to externally rotate the shoulder. Again, I used two mirrors, the mirror wall in front of him and a big mirror behind where he can see both his shoulders. This way he can move his left, the unaffected shoulder, and see how it moves and then try to do it with the affected side. You can use this setup also with a variety of other shoulder problems or neck pain. And later on in the video you will see that you can use two smaller mirrors to achieve the same effect. Again, I have drawn lines on his back and a little arrow on the right, so he's better able to visualize when his shoulder blade is moving towards the spine. As you can see, he's trying out different movements so he can get a feel again how a normal shoulder would move. In order for him to be able to concentrate on external rotation alone, we use a sling trainer so that he doesn't have to hold the arm the whole time. He feels that it's easier to move the shoulder into external rotation when he's doing it with both arms at the same time. This shows the progress he has made within 3 days. It looks right from the start much smoother, and the arm goes into external rotation a bit further. That might not seem much, but in conditions like this, after a year of not being able to externally rotate at all, this is quite a big step forward. This is also the alternative setup with two smaller mirrors that one can quite easily do at home. This shows his range of motion after a week. Again, this might not seem to be very much, but if you consider how he started out, this is actually pretty good. As you can see here, you can train external rotation in different degrees of shoulder abduction. And you can also change movement speed and other variables. It all depends on what kind or what type of problem your patient has and how far his arm can already go. Here you can see that he's able to hold the arm externally rotated, which he couldn't do a week ago. So clearly something good is happening with his shoulder, and we'll see what the follow-up visit to his surgeon brings in 6 months. This is the range of motion after 1 week of therapy, a combination of mirror therapy, strengthening exercises and impairment-oriented training.